Welcome to another episode of the Bandage Podcast, a weekly wrap-up of the most trending healthcare news. Each week, we'll discuss the latest in healthcare, health IT, and compliance.
In this week's episode, we discuss suicide-related court hearings, the deadly effects of binging alcohol, and the spread of monkeypox in the United States. Let's wrap things up. This is episode 140 for the week of June 20th. I'm Matt Moneypenny.
And I'm Albert Battistelli.
Before we get started, our diagnosis code for this week is W58.01, or bitten by alligator.
Chomp.
This exists just because of Florida.
Yes.
And Louisiana.
Yeah.
Obviously.
Everglades and...
Yeah, Everglades and things like that. And
I remember, like, when I was a kid, there was this Mighty Mouse, I think it was Mighty Mouse cartoon, where they went to, like, the Everglades and, like, the Okefenokee swamp or something, and they had to, like, wrestle or fight. And I know. But the alligator wrestling was, like, WWF or WWE style wrestling. I know. It was pretty funny.
It's getting intense.
It was really, really funny at the time. And I wish now that I could go find that, like, cartoon and watch that little cartoon again.
Yeah, that is wild. But, you know, yeah, I don't know. I don't know what to say to that.
I don't know.
I've never heard anything like that in my life. So, yeah.
Bitten by an alligator, though. It probably happens more often than you think.
Yeah. I imagine
alligators just, like, come right up to your, like, lanai and, like, in some of those places in Florida. They just, like, crawl right out of the water and...
They just come out and grab you and then do their... And then that's it.
Right.
If you survive that, then you're going to get this diagnosis code. So,
right.
You got that going for you, which is nice.
And a badge of honor, because those little jerks can really do some damage.
Right. Agreed. 100%.
100%.
First up, we've got, are doctors liable for suicides? The Ohio Supreme Court will decide whether those providing mental health services are immune from lawsuits if their patients kill or harm themselves. A mother filed a lawsuit after her 30-year-old son hanged himself at the county jail. Her son had been arrested for not complying with mental health treatment, a condition of his probation. The lawsuit filed against the county and its jail health services provider claimed that the jail failed to properly supervise the inmate and provide him mental health care despite him clearly needing it. The health services provider said the lawsuit has no grounds under a 2014 Ohio law, which lawmakers had passed in response to a prior court decision. Lawmakers disagreed back then that the idea that therapists and others were completely responsible for patients' violent tendencies. Instead, the 2014 law gives mental health workers and organizations immunity from liability and disciplinary action unless they knew of an explicit threat that could harm one or more clearly identifiable potential victims and failed to take action to stop it. So this would be wild if that happened, if therapists were starting to be held liable for the actions of others. I don't know.
That doesn't sit well with me. I don't feel like that's...
Yeah. I don't think that's something that's going to pass. Hopefully
Well,
not.
no, I hope not, because a lot of times when you're working with people with mental health, there's a lot of variables involved. There's a lot of unknowns. I don't think it's possible to, like, guarantee that your patients aren't going to do something
right
when you're not around. I mean, mental health services or mental health providers only are with them a limited amount of time.
Once a week.
Or something like that, maybe depending on the severity, but that seems surprising that people would even consider that was the responsibility of someone. Now I can see, like, if you're supposed to be somebody's mental health provider and you're just doing a crap job, or you're like not showing up to appointments or constantly like pushing off your responsibility to this person, suddenly they do something dumb. Like, maybe in that kind of situation, you didn't hold up your end of that, like, patient doctor relationship. I don't know, but this situation
I think the 2014 precedent hopefully holds true. Hopefully nothing crazy happens, because this could go really bad for a lot of therapists. But I also think that because mental health is so bad, I feel like therapists are going to continue to be held under a microscope on a governance level as it continues to get more awareness and gets more people start seeking it out a little bit more. So hopefully nothing bad comes of it. But might be just the first example that we've come across that kind of aligns with that theory.
For sure. All right, next up, bamboozled by binging. A recent study found that many moderate drinkers above age 30 actually end up binging on the weekend, defined as 5 or more drinks in a row or within a short period of time. People who binge drink were 5 times more likely to experience multiple alcohol problems, such as getting hurt, emotional or psychological problems from alcohol, having to use more alcohol to get the same effect, and experiencing effects of alcohol at work, school, or when caring for children. Most past research on binge drinking has focused on younger generation, like teens and college students. But statistics show that many adults over 30 are binge drinkers, and the problem is on the rise, especially among women and adults over 65. Those
binge drinking is very bad.
Yeah, don't do it.
Just to quote, was that Chingy?
Chingy, maybe.
No, it wasn't.
Hold on.
Was it Chingy? No, it was Jaquan.
Tipsy.
One hit wonder. Classic.
Yeah.
Still reigns true. Ahead of its time.
Ahead of its time. It knew. He knew.
He knew that we were going to be talking about bamboozling binge drinkers.
Right.
In 2022, way back in early 2000s. And here we are today.
And honestly, if you wanted to know whether like boomers binge drink, I could just be like, yeah, look at my family. Like, I could give you so many examples of people I'm related to that binge drink that are above the age of 30. First of all. So this is not something that only teenagers do. In fact, I would say they do it way more.
Especially among women and adults over 65. They got nothing to do when you're 65.
They're retired. Literally, they wake up. They're like, I'm going to start.
Get off the case.
Start with a mimosa, and then you just go all day.
Listen, if they want to have a fun time, they can have a fun time. I feel like by the age of 65, they've earned binge drinking if they want to. Now, I'm not saying you should. I'm just saying that I certainly am not going to get on a 65-year-old case about having some alcoholic beverages at 12 o'clock in the afternoon.
All right. Everything hurts when you're 65. Your knees, your back. You got to drink to make that stuff bearable. Also, like, I don't know. They're not going to work. Well, they might be. Some might be. But hopefully most people are retired. Yeah, most people are retired. They're not worrying about being drunk on the job or at school or when caring for children. Their kids are gone, hopefully. Like,
this probably also has to do with there's probably a correlation between binge drinking and mental health. So I have a feeling that they're kind of directly related, where if you have increased mental health issues among the population, there's going to be increased drinking.
It notes here, especially among women. And I was like, look around. Women have some reasons to drink. Like, no wonder.
No wonder. Next up, monkeypox is spreading. Monkeypox is officially in Oklahoma. The state's first, quote, probable case, reported last week, was positively confirmed by health officials. Health department spokespeople said they worked quickly to isolate the resident and contact trace those whom the patient might have exposed since reentry. The health officials reiterated their initial comments that risk to the general public is low and the virus is not easily transmissible. As of June 13th, at least 1,678 cases of monkeypox have been identified in 35 countries, according to the CDC. Of those confirmed cases, at least 64 are in the U.S., but the disease is so comparatively rare, authorities say even one case is being considered an outbreak. I definitely don't still believe, and I don't think that people are going to take this disease seriously. So I'm glad that it is not very transmissible and potentially not on a pandemic level. So that's good.
64 cases, not so bad right now. Not so bad.
If it gets higher than that, people are still going to be like, nah, dude, I have monkeypox. I'm going to Walmart.
Mm-hmm.
And you shouldn't do that. But hopefully it doesn't happen.
Yeah, don't do it.
But if it happened the way that it did with COVID-19, safe to say, people wouldn't take it seriously. So
true. That's true.
feel bad for the person in Oklahoma. Hopefully they're safe.
Yeah.
There's only a few states that have monkeypox. There's only one Midwestern state that has monkeypox, and that's Illinois. It's because Chicago's a dirty city. That's why.
True.
But let's go to our next segment.
BREACH, Breach Patrol. It's a breach! All of the latest cybersecurity breaches.
Welcome to Breach Patrol, where we talk about the latest breaches all across the world. Whoa!
All right. Vendors breach backlash. MCG alerted one of its customers, Avera Health, of a breach that affected Avera's patients. MCG learned about the data security issue on March 25th. They provide patient care guidelines to healthcare providers and health plans. About 700 Avera patients' information were accessed by an unauthorized party. Breached information included social security numbers, medical codes, postal addresses, telephone numbers, email addresses, and dates of birth. MCG started sending out notices on June 10th to affected customers and advised them to monitor their credit reports and account information and to check for unfamiliar activity. Whoa,
unfamiliar activity.
Be careful. Be always on the lookout for unfamiliar activity when it comes to your accounts.
Yeah, watch out.
Yeah, social security numbers is always like my least favorite words to read on in any of these breach patrol segments because it's like, what? How?
Mm-hmm. So
like you gotta lock that crap down.
Yeah, lock it down. Shouldn't be all just willy-nilly available.
Yep.
How do you knock it down, though? That is a bigger question that this podcast can answer at the moment. But this is an example of a healthcare organization having a vendor and that vendor having access to the healthcare organization's protected health information for whatever reason. It's probably because there might be like a claims provider, or maybe they do encryption or, something like that. And that vendor then gets breached. A hacker gets into that vendor's code, and then they have access to Avera's Health through whichever connection form that they have. Maybe it's some APIs or something like that. But this is a good example of that. Very scary. Very, very scary.
Right. Be careful. Be careful with people's info.
You've got to evaluate vendors,
Yeah, evaluate your vendors. Ask what their security procedures are.
There's still a chance that it happens. So maybe that happened. I'm not saying MCG doesn't have good cybersecurity. I'm going to assume that they do. I'm going to err on the side of caution and say that they do. This is just a one-off thing that happened, but it does happen.
It does.
Next up, a classic case of snooping. The Santa Barbara County Behavioral Wellness Department reported that there was a breach in its medical system. Department found that a staff member used their credentials to log into the electronic medical record system and viewed client information on March 30th, but an audit of the incident showed that no information was downloaded or printed. The breach included names, addresses, emails, phone numbers, social security numbers, insurance information, medical record numbers, and some medical information. After the department discovered the breach, further access to the client records was terminated, and the department implemented all required and appropriate actions to the employees who access the records. All required and appropriate actions.
Strange. So this seems like it was just one staff person who just like logged in somewhere that they shouldn't have, didn't do anything, but
I can't believe that this
still considered a breach.
I can't believe that this made headlines.
Yeah.
How did this company? I guess they're just taking their due diligence. I mean, how much?
I don't know. Well, it's
how
much
files did this employee view? I mean, it takes some guts to just announce, because I feel like a company could happen to a company, right? A healthcare organization where they have someone who's like a secretary, and the secretary has more access than they should. They go clicking around. And then the secretary is like, oh, no, I was looking at protected health information, and they just exit their window and then go on their day, right?
Right.
But no one's going to know that happened other than the organization.
Right.
So in this case, if Santa Barbara had to, by law, tell local media because of the breach notification rule, because maybe this breach affected more than 500 protected health information data points.
Right.
Good for them, good for
Yeah,
them for staying true to the law and putting themselves out there in a bad light, even though it is required by law. But it takes guts to do that from a business perspective.
It does.
For sure.
Especially when it doesn't appear that anything was actually no nefarious things were done here.
I hope that the employee wasn't fired. Now, I don't know the full context,
right?
But I'm going to assume that the employee wasn't doing this out of spite for anything.
Right.
They just kind of did it on accident.
Right.
So hopefully the actions that were taken place by the organization were on the IT department level, saying hey, why does this person have access? Let's put in safeguards to make sure that she doesn't have access. And so that other employees like her don't in the future, rather than, hey, we're going to fire you because you clicked around on accident for something that we didn't, think of ahead of time. But I don't know the full story, but I'm just saying.
Right. Or some coaching. Just be hey, that's just not a place where we go.
Yeah.
All right. Not the number one spot you want. If you've lived in the U.S. for the past 18 years, your personal data has been illegally accessed on an average of 7 different occasions, according to a new report. The United States is at the top of the list of countries with the highest amount of breached online accounts in the past 18 years, with over 2.29 billion breaches in total, which adds up to 694 breached accounts per 100 residents, or 6.94 per person. That's not a great number, but depending on how you count the breaches, one other country actually has it worse. Russia only has 2.7 billion breaches in the same time frame as the US's 2.29, but it adds up to far more per 100 people. 1,489 breaches, more than double the US's 694. China, Germany, and France are numbers 3, 4, and 5 on the list respectively, though none of them crack 1 billion breaches since 2004. It makes sense to me that the US would be the top of this list, because I feel when it comes to technology and cybersecurity, anything like that, the US is usually leading in those things versus other countries. So I feel it makes sense, and we have a lot of people.
Yep, and we're the biggest economy, and we're the biggest target, the most targeted government, right?
Right. It just makes more sense that we would have the most breaches.
Exactly. But I'd say I also don't know. I mean, I feel like Russia probably isn't reporting as many breaches publicly as the US either. I don't think China's doing that either. Right? Germany and France are smaller economies, smaller countries, so it makes sense that they're up there because they're super modernized, but they're not necessarily they're not bigger than the United States from a geographic standpoint. But I don't think China and Russia are probably reporting their breaches publicly because their governments don't really require that, right? Whereas the US, it's okay, if a breach happens, you got to tell us, especially on the healthcare side. That's a requirement by law, but it makes the country look bad, right? Whereas China and Russia are not trying to make the country look bad because they want to make themselves look as powerful as possible. So kind of comes down to the same thing with COVID, right? The response or publicly announcing how many COVID cases they have.
Right.
It's the same kind of deal, but it's cybersecurity. So it's a little bit different, but not really.
Right.
But hopefully, that goes down, but I can't foresee that US is ever going to not be the number one spot for that.
Right. Me neither. It just makes sense.
And that's it for this week's wrap up of your weekly healthcare news. I'm Matt Moneypenny.
And I'm Albert Battistelli.
And we'll see you next week.
Thank you for listening to the Bandage Podcast produced by eTactics.